businesses resumed, and schools providing in-person instruction. On the basis of what we as a community achieved, we successfully created a program to attract others to our shores to work while their own countries came to grips with the pandemic. Mr. Speaker, regrettably, and as has been the case in other countries, things have changed. Our country's status has been elevated from sporadic cases to clusters of cases, and today there are 7 confirmed clusters which are at the heart of this outbreak. Mr. Speaker, though we have many cases and several clusters, it is due to the excellent work by our health team in contacting and isolating, testing and following up with confirmed cases that we have to date not moved to the WHO definition of community transmission. Mr. Speaker, it is against this backdrop that we take the actions I announced today. I am determined, as is the Honorable Member, the Minister of Health, and the entire government, that we do all we can to prevent the declaration of community transmission in Bermuda. Mr. Speaker, this means that it is essential that we must now reinstate some of the restrictions that contained the initial outbreak earlier in this pandemic period. Mr. Speaker, I can inform this Honorable House and the public that in a meeting held last night, the Cabinet has approved the following measures, which will take effect from 6 a.m. on Saturday, the 12th of December. A curfew will be in effect from 11 p.m. until 6 a.m. daily. All businesses will be required to close at 10 p.m. The maximum permitted number in any group will be reduced further to 10. Gyms will be required to operate at reduced capacity, and those personal services like barbers, hairdressers, massage therapists, and spa technicians will not be permitted to provide those services that require a mask to be removed. Mr. Speaker, these restrictions are not imposed lightly or wanton. They are guided by public health advice and based on the trends identified in both the average age of the confirmed positive cases and by the results of the contact tracing. The numbers do not lie, and the story they are telling cannot be ignored. This outbreak is being driven by residents, more specifically, young residents. More than a half of the new infections reported over the last 6 days are residents under the age of 30. Mr. Speaker, I think it is important to set out clearly why these actions are being taken now, as opposed to after we determine the impact of those changes made earlier this week. Mr. Speaker, in the past 6 days, we reported 86 new confirmed cases. It is the view of the Ministry of Health that the numbers will get worse before they get better. It is therefore essential that we implement further action now to avoid possible harsher action later. These additional actions, layered upon the actions that were announced earlier, will serve as a further insurance policy. If the actions that were taken earlier this week prove to be effective in halting this outbreak, that would be welcome. However, if they are not, then it makes more sense to layer further actions on top now versus waiting until December 22nd to judge their effectiveness. As I stated on Sunday, Mr. Speaker, we will review where we are as a country and where we stand on December 22nd to judge what our new next steps will be. I am conscious of the economic impact that this will have, and I am sensitive to the festive season in which this is taking place. And I know that people are tired and worn from the change that 2020 has brought to our lives. I certainly am, Mr. Speaker. Mr. Speaker, make no mistake, the threat is real. Thankfully, hospitalizations remain low, but these numbers of positive cases make that an ever-decreasing likelihood of continuing unchanged. People of a certain age will know the expression, joyful nights bring sorrowful days. Mr. Speaker, we must avoid a scenario where the actions of some lead to the death of others. Just as our actions in the spring saved lives, preserve health, safeguard our most vulnerable, and gave us the foundation on which to found an economic recovery, so these preventative measures will do the same in December. Mr. Speaker, the adoption of these actions will form part of a revised set of public health regulations which will provide for the necessary exemptions from their provisions which previously applied. That process will be revived, and the Ministry of National Security will again be prepared to effect the permissions required for those whose movement within the hours of curfew must be sanctioned. And Mr. Speaker, the applications will be on the government website at gov.bm. Additionally, Mr. Speaker, members are advised that stronger public health guidance will be issued to encourage less community activity and urge residents not to mix households for at least the next 14 days. Mr. Speaker, many businesses have maintained a return to remote working. I am advising both public and private sectors that the strong public health advice is, if you can work remotely, you should do so. The head of the public service is already determined how this will impact the front-facing operations of government, and public sector employees will be advised by permanent secretaries and heads of departments. Mr. Speaker, with the growing number of people who are either testing positive or identified as close contacts of those who have, there is a need to ensure that clusters are contained and do not extend. I am therefore grateful to the management of the Cocoa Reef Hotel, who agreed to offer a specially negotiated rate of $79 per night for those who are unable to quarantine effectively at home. Mr. Speaker, the skilled and committed men and women of the Ministry of Health are operating at full bore in the testing, tracing, and monitoring work this pandemic has caused. The scale of this outbreak is testing their systems and taxing their stamina. They are meeting the challenge daily, but it is difficult, and they are becoming stretched. Our government lab received over 1,800 samples yesterday for testing, smashing any previously recorded daily record. Additional help has been called in, and additional resources are being brought to bear. Why do I raise this, Mr. Speaker? I raise it because the moment the health system breaks and the people within it cannot maintain the pace at which they must operate to contain outbreaks such as this, we run the risk of entering the realm of community transmission. And at that point, we cannot say what Bermuda will encounter. One thing is for certain, it will certainly jeopardize our hard-earned progress to date, and we must all work together to ensure that does not happen. This means that we all have to play our parts. First, Mr. Speaker, I encourage residents, do not be your own doctor. Follow public health advice. If you haven't been exposed, please do not take up valuable testing slots for those who may have been exposed. Do not book multiple tests on multiple days. Speaker, the booking system is being modified to prevent this. But one of the challenges, Mr. Speaker, is that persons were booking multiple tests on multiple different days, taking away the limited testing slots. The third thing, Mr. Speaker, is to be patient. In Bermuda, we are spoiled because we're used to receiving our results in sometimes as little as 6 hours. The results will take a little bit longer than normal, Mr. Speaker. So I ask residents to be patient. Mr. Speaker, now is not the time to panic. Now is not the time for Bermudians to start fending for themselves. Now is not the time for us to turn on each other. Now is the time to remember that we are really in this together, and it is essential that we embrace that community spirit that is so important to our island's progress today. Mr. Speaker, as the Honorable Minister of Health said earlier today, vaccines are on the way. We have technology launched today in the form of the We Health Bermuda app so that people who are exposed can receive anonymous exposure notifications. We have the tools at our disposal, and we have an amazing team of committed healthcare workers who will continue continue this fight. Mr. Speaker, though some may wish, now is not the time for pointing fingers, as there will be plenty of time for examination over what happened with this outbreak and how exactly did we get to this point. Lessons have been learned, and we have increased the protections at our border to bolster the protections provided to our country. The Ministry of Health has revised activities allowed for travelers, and all persons who arrive in Bermuda will be subject to those restrictions. Additionally, with the new agreement announced yesterday with U.S. retail giant Costco to get a pretest, there is no longer an excuse for residents to not obtain a valid pretest prior to boarding. Therefore, the fee for a resident to return to Bermuda without a pretest will be increased from $30 to $300. This increase will discourage residents from boarding flights without a valid pretest and will help to fund the enhanced monitoring of those persons arriving without a pretest. Mr. Speaker, while we enhance our protections, we must also support those who will be negatively impacted by the actions the government has taken. At 5 p.m. today, persons who have not been able to work due to closure notices that were issued effective on Tuesday or who have been served with a quarantine notice and cannot work remotely can apply to receive support. The Minister of Finance has stated that any completed application received by 5 p.m. on Monday will be paid by next week, Wednesday, December 16th. Verified full-time employees of bars and nightclubs who are closed will be eligible to receive $1,000, representing 2 weeks of the unemployment benefit. The application will be live at 5 p.m. today and will be able to be accessed at uba.gov.bm. Again, that is uba.gov.bm. The information required to apply will be as follows, Mr. Speaker. Full name, social insurance number, mailing address, contact details, a bank statement without a bank balance to ensure payment to the correct bank account, and employer name and contact information. Mr. Speaker, I know that this is not the news this government wanted to deliver, or that the people we serve in this honorable House want to hear. However, Mr. Speaker, I firmly believe that these are the correct steps to take. Mr. Speaker, I would like to acknowledge the support of the Leader of the Opposition, not only in the statement of support he graciously issued earlier this week, but also for his confirmation of support of these new measures when we spoke by phone earlier today. Mr. Speaker, before I close, I want to pay special homage to the men and women of our health and pandemic response teams, the people manning the phones, people collecting test samples, people processing coronavirus tests, people communicating to residents, tracing down contacts, assessing businesses, designing guidance, drafting laws, handling arriving passengers, enforcing quarantine, and responding to the media. Mr. Speaker, these men and women are our army in this war, and it is our country's responsibility to support their fight. Mr. Speaker, I commend these measures for the support of the whole House and would ask that honorable members join me in this all-out effort to keep Bermuda safe. Thank you, Mr. Speaker.